Welcome to Advancing Health. Hospitals and health systems never stop working to advance patient safety and quality. It has been and always will be our field's top priority. In today's conversation, two former American Hospital Association board chairs discuss the importance of bringing a culture of safety reporting to an organization and how technology can't replace the human factor in a successful patient safety strategy. Dr. Mindy Estes is the former CEO of St. Luke's Health System in Kansas City, and her guest, Nancy Howell Agee, is CEO emeritus of Carilion Clinic in Roanoke, Virginia.
I'm Dr. Mindy Estes, and today we have the privilege of speaking with Nancy Howell Agee, CEO of Carilion Clinic. Nancy's remarkable journey began as a nurse when her commitment to patient care laid the foundation for an extraordinary leadership career. So let's just jump right in. You've had a remarkable career from nurse to CEO and long service in the field for AHA and other organizations. And so I think it really gives you a unique perspective on healthcare quality, safety, equity, workforce, all facets that go into a quality organization. So thinking back, what have been the most important actions you've taken as a leader to drive quality and patient safety?
Well, I'm glad you mentioned that I began my career as a nurse, and I treasure the fact that I am a nurse still, and those one-on-one patient encounters are what have always driven me. The notion that you're caring for one person after another and how you do that the very best of all. As I became a leader in healthcare, about the time that I was moving as a chief operating officer and then the CEO, I was a representative from the American Hospital Association to the Joint Commission, and I was on the Joint Commission board. And at that time, we were beginning to talk about zero harm. And so I was hearing from the AHA in one ear, patient safety, quality, and in the other ear from the Joint Commission, patient safety and quality. So in stereo, what's really important? And I pondered that quite a lot as a leader to look at our own organization. What could we do differently? Not just check the box, not just meet the regulations, but really understand fundamentally what it meant to improve healthcare, improve patient safety, and improve quality. It seemed to me that it needed to start with the board. And so sort of a bottom-up, top-down conversation of education about our highest priority and what that meant. And when we talk about statistics, it's really important to measure quality, of course, but a statistic represents a patient. And so we began to frame how we think about quality with a patient in mind, not the patients, but a patient. And it seemed to make a difference. At that time, we reorganized the board and the board committees. And while we had a quality committee, it wasn't perhaps as robust as the finance committee. And it seemed like the committee that got the most airtime at board meetings was the finance committee. And educating the board about what it meant to be an integral, high integrity, zero harm organization. So we renamed the quality committee for the board CAPS, Clinical Advancement and Patient Safety. And now the two most important board committees are CAPS and Finance, and our board chair sits on both. In hindsight, it was really important that our board chair began to own patient safety and quality as the single most important thing. I'll tell you something else we've done, Mindy. We celebrate what we call the great catch. And so the more event reporting that we do, we think that's fantastic. And so we, any little thing, any big thing is funny. I was waiting on the elevator, a gurney went by and it went a little too fast around the curve. And there was a resident standing there and he said, "Hey, I think we need to put that in the event report." And it was, just kind of an everyday encounter, but it was a great focus. The other thing we did was create a new set of values. Our mission is to improve the health of the communities we serve. We focused on our values, and our values include courage, compassion, curiosity, commitment. And by focusing on those values, we use those to talk and to educate regularly for new employees, as well as every year the required education for all staff include focus on our values and what that means to patient safety and quality. And the last thing I'd mention is that we organized everything under one umbrella. So everything from risk management to quality reporting to all the sort of things we do for preparation for Joint Commission, for surveys from our state, patient safety, patient advocacy, and our human factors team and our sim lab are all under one umbrella. And creating that real focus that's both education, metrics, and celebrating the good work that we do.
It's remarkable. There are a couple of things that have struck me. One is your point about so much time spent in board meetings on finance. And one of the things that we did at St. Luke's was to reorder our board agenda and have a quality close, if you will, just like we have the financial close, where we are presenting the quality metrics not only on a monthly basis, but year-to-date basis, so that we have time on the front end of the board meeting to talk about quality as opposed to whatever time we had left. The other thing I would mention is, as you know, I'm currently on the Joint Commission board, and we talk about innovation and quality and patient safety. And the conversations when you were on the board beginning to talk about do no harm. You know, today Joint Commission is innovating and innovating rapidly. So I think it really is organizations and the Joint Commission in this instance marching together from a foundation that's been created over a number of years. You helped develop Carilion's innovative care model. Undoubtedly, and I've heard you speak on how that evolved, and I know you have a lot of insights for other leaders. So if you were advising a new system leader, and there's certainly, as we've seen movement in healthcare, there are a lot of new system leaders in our field, what would you tell them to do first to set the tone for an effective culture in the organization? I think you've already touched on that, but I know there's more.
I think creating an environment of this is our highest priority means you're using every single meeting, every memo, your social media. We have an internal social activity. We focus on that with every single communication that we have. And I think that that's critically important. But I'm glad you mentioned technology, because both existing technology and new technologies, again, we focus on why we're doing this for patient safety and how it improves quality. And by having that as our key priority, I think it begins to permeate the organization. Technology is important. If you ask me what doesn't work as well as you thought it would when you first started, I'll say introducing an electronic health record. I remember when we did that, and we did a big bang approach. And I remember these words probably came out of my mouth as much as anybody's. We're going to eliminate medication errors by having this technology. And of course, that's ridiculous in hindsight. There's nothing that can completely alter the human nature of our business, thank goodness. But because we are humans, mistakes can happen. And so doing everything you can to have a safe environment, to create a culture that's a permissive culture that encompasses patient safety and quality as everything that you do, I think that makes all the difference. Mindy, you and I go back a long time. We used to think about things like central line infections and catheter infections, and I don't know. It wasn't that we were cavalier about those things. I think we were just as concerned about patient safety and quality. We didn't recognize the whole milieu that it took to care for every single patient every time in the way that a patient should be cared for. And when I look back and I think about some of the things that we perhaps took for granted or didn't realize that we could change, and now I look where we are as an industry, our whole field has improved patient safety and culture. And I think there's even more that we can do.
To your point of change, I think organizations like ours, we test, we pilot, we retest, and, we want consensus. And if we don't like the first pilot, we do another one. And I think COVID taught us very quickly that, we can innovate and we can innovate quickly. And we can learn from that innovation. And if we fail, we need to fail quickly. And you touched on the electronic record. And my next question here was just going to be, what did you learn from something that wasn't as effective as you might have hoped?
Well, I'll just echo, first of all, that you're right. During COVID, we learned, and I hope we continue to learn that lesson, and that is innovate quickly. I think we can be accused of being way too slow and thinking through things, which is important. We have a saying here, take risk without being reckless. After all, you are talking about a patient's life. The notion that we can innovate, that we can recognize a need and do something about that and take ownership at multiple levels. So I think one of the real lessons that began before COVID, but really came home during COVID, was the necessity for focusing on the resilience of our staff and all the things that we can do because, as a CEO, you and I are not really important to that patient interaction, that precious moment between a caregiver and a patient. And so all the things that we can do to support our staff so that they can give the kind of high quality, safe care that we would expect.
Resilience continues to be important. And I think in this day and age is something that we used to take for granted as well, that the mission and the privilege to do what we do would fuel internal resilience. And I think part of this whole patient safety, quality of our workforce and our workforce's experience as well, that resilience and how we take care of that has become increasingly important. And Nancy, I want to thank you as always for your time, for your sharing your insights and experiences, and your journey from being a nurse to an award-winning CEO, and your successful transformation of Carilion Clinic. It really provides powerful lessons for all healthcare leaders at all levels. And your commitment to quality and safety, innovation, combined with your dedication to mentoring future leaders, especially women in healthcare, truly exemplifies exceptional leadership. And, we've seen through your examples how healthcare organizations can navigate while maintaining an unwavering focus on quality and safety. Because at the end of the day, that is what we do, to provide the highest quality patient care and safety to our patients first and foremost. And I really think it's important for our listeners to realize that underlying all of the success you've had is the heart of a nurse.
Oh, thank you, Mindy.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.